Now, my postdoc, who was from Singapore, Cynthia Chen, who is fabulous, made up this graph, which I think is great. So we've got the 5 domains, and the direction from the center toward the domain is the stronger, the higher score. And we have different countries. So if you look, the red is the United States. And the United States, it looks like a pentagon, but everything in the United States relates to the pentagon. But it's it's pretty symmetrical. So we're equally bad or equally good in everything, okay? Spain, fabulous in cohesion. Terrible on productivity. What are they? They're all kind of sitting around all day getting together and getting along really well, but not doing anything, you know? They need to get going. And one of the things I like about this is like not a pentagon, but a pentathlon. It's, you know, we'll get back to the Greek metaphor here. If you're going to win a medal in the Olympics, you have to score in every event. You can't really get wiped out on the javelin. You get wiped out, you're not going to get to the podium. You have to get points on every event. In order to be a productive, successfully aging society, you got to make progress in each of these areas. You can't just get wiped out on something. Ned?
Which of these dimensions does and does not correlate with GDP per capita?
Well, the one that actually includes GDP per capita is security. So if we go back, security includes the income for people age 65, net pension wealth, and external government debt. Equity includes the Gini coefficient for people over 65, which is the distribution of wealth within that. So this includes the GDP per capita, and this includes the distribution of that GDP across the individuals.
The reason I ask the question is so it implies, you know, things that, for example, do not correlate with it.
Yes.
Imply that it's not a wealth-driven.
Completely. And I have a slide which I'm not going to show, but given the time, looking at the correlation coefficients between the different domains, and you get 0.4 for GDP per capita for a couple of these other things, which means it's describing 20% of the variance. And so it's not, the economists just say it's all about the money. It's not all about the money, is our message. And in conclusion, you know, this index highlights the core domains of successful aging. It's robust to different weighting schemes. Didn't matter which weighting we did. It captures what we think is available information about demographic transformation. It uses countries as a benchmark and thus can highlight potential improvement areas. And we can analyze the scores in the context of existing policies. So you can say, okay, does the United States Social Security policy provide economic security and at the same time promote people staying in the workforce? And the answer is actually it does compared to other countries. It does much better than most people think.
How do you define well-being?
Disability-free life expectancy. That is the age that people live to without any disability. Rather than, and that's 70%, and 30% was a subjective measure of life satisfaction in older persons.
We call it
Inmorbidity, okay. And that 70-30 was the result of a fight among the group. And now what we did is, if anybody's interested in this, you go to our website, agingsocietynetwork.org. Our model is up there, and then you can change the weightings for anything. You say, nah, these guys are out of it. I think this is more important than that. Change the weightings, push a button, and it'll recalculate the index.
I think it's clear that all these indices are interrelated, right? And the question is really, where do you put the larger weight? From a policy viewpoint or from an economic viewpoint, you put some more weight in certain security. But if you were individual, you put a lot more weight on well-being, which are driven by many of the other indices, right? So I think that's at least the way I'm looking at it.
I think that's right, but I also think that people will say that they're gonna assume well-being. And they're gonna say, well-being is not enough. I can take care of myself, I can get some health care, but I've gotta get this society oriented in such a way that I can be productive and be
Do I have to put it on?
So I think they're both sides of the data.
I have to put it on?
If
No,
I'm
I
a
don't
young
think it is.
citizen in one of these
I don't think it
countries,
is.
what extent do I
It's
care
on.
There's
about
no
this?
sound,
Because,
just
you know, I'm
recording your
older,
voice.
citizen
Ooh, I don't need
here.
this
But is
on.
the-
No,
is
there's no
the,
way to do
is
Leave
the-
it there.
Is the reason for this have to do, if you're young, this is how I'm gonna get treated or how my life is gonna be when I get old? Or to what extent can we directly say to young people, this is important to you now and not just, it's not just important to older people?
Very good question. I think there are, I would have three responses, and they vary for relevance to a given young person. Number one, for many young people, the issue is how are their parents doing, or their grandparents, and that's a concern. The second is that many young people who are working are paying into these programs. They're paying Social Security, et cetera. They're paying the Medicare income tax.
Yeah.
They want to know whether they invest in getting their money's worth
Yeah.
in terms of that. And then the third thing is that people should realize that to have a society in which there is dramatic tension between two major age cohorts is a risky strategy. Those societies are associated with much more violence, much more upheaval, much more political instability than cohesive societies. So those would be three reasons. Basically, what kind of country do you want to live in is what it comes down to.
So I'm thinking, could I just follow up and say that it seems to me this is an important piece of what we need to do here in terms of, is to get a message to the younger people as to why this is important, not just to the older people.
That's a good point, yeah. George?
A question, and also looking to what David was asking. The Gini coefficient you are measuring is from 65 above.
That's right.
Okay, there is a study in the UK, I'm not an expert in this, but I've read about it, and actually heard about it, where they actually measure the effect of the Gini coefficient from an early age on longevity.
Yes,
And so therefore, and it does seem that it has an impact.
yes.
So that, on the other hand, is important because you need to know if there's a wealth disparity, it will affect long-term longevity.
You're way ahead of us. And so for those of you not into this, the Gini coefficient is a widely accepted measure of the distribution of wealth across a population. So that a country that has maybe high taxes and a lot of wealth redistribution strategies would have a good Gini coefficient. And a country in which there's a small group of very wealthy people and a large group of very poor people would have a bad Gini coefficient. And the finding that George just cited was the reason we included equity as one of the 5 measures of a successfully aging society, because it has been found that the Gini coefficient for a country is predictive of late life well-being. So that's why it's one of the 5. So we had to have evidence to support each of these 5. And that study was the study that put this one on the map.
Okay, I just
Exactly.
thought it might be useful to look at the Gini coefficient from a younger age too.
We did, and it didn't make a difference in the score.
Okay.
So we did it for over 65 and everyone, and it didn't make a difference in the score. That's excellent. This is exactly the conversation
So-
we would have in the group, you know.
To what extent do social policies in this case affect this indices? Probably mainly through equity.
I think financial security, how big is Social Security, what are taxation rates, how generous is the healthcare system, public security, how safe, how much investment is there in law enforcement, et cetera. Transportation and housing, it's a good, safe housing for older people. These are all social policy directed things. So it permeates several of these. Equity, yes, number one, but some of these others also. Yes?
Just a couple of thoughts. One on the question about how do we mobilize the youth or the younger cohort to care about this is an interesting question, but there's a next generation in the middle who are mobilizing but don't know how to. I can tell you as an employer, the issue of elder care, we used to talk a lot about child care. We have employees right now that are just frozen in place. They don't really know what to do. They've got aging parents and we don't have a system to deal with it. And bereavement policy, these are things that we didn't talk about in the past. So I do think that we have to almost think different sort of generational targets. The other thing that's sort of interesting to me, because I serve on the 4th District of the Federal Reserve, is some of the metrics that we use and whether or not we have a hard time right now in the Fed sort of thinking about the gig economy, right? It's when we were used to measuring employment in certain ways. So the other thing that might be interesting here is whether or not, if you look at demography, is some of that aging population participating in a labor force that we don't capture very well. So I think there's just some interesting questions we should ask about the data. And
That's right, and there's also the opportunity, if we had funding, to do this in Asia and do this in other places. This was a data set of convenience because this was available. Now let me just give you an idea of the appetite for this. This was published this summer. So far I've been invited to speak to the World Bank, which I did, the OECD in Paris, which I did, Standard & Poor's. I got in the room at Standard & Poor's and they said, we're interested in including this in our rating of the sovereign debt of countries because we think how successfully they're aging might be a financial risk factor. And last week, a venture fund in London called me and said, we read your paper, I don't know how they get these things, and we're interested in starting a fund that will invest based on demographics. Would you come talk to us? So I never got responses like this from studies of the physiology of aging in rodents, you know. I mean, there was not a lot of it. So there's a lot of appetite for this. Okay, Kavita.
Primary subject, isn't it? And I think later on when you hear called roadmap, part of the Grand Challenge, an Internet Commission, really these things are going to be very relevant. You're going to talk about that, right? Because policy matters. Go ahead.
So I come here very much as a social scientist who's worked on aging. I have a new, if I might do some self-promotion, I have a new book which is called As the World Ages, Rethinking a Demographic Crisis. It's just been published by Harvard University Press in 2018. So some of the work I've been doing over the past years really tries to understand how aging is understood in what I think are really youthful societies. How do societies that have aged over just one or maybe half a generation, over 25 or 30 years, how there's the coexistence, as we just said, of youthful and old populations together. That's the first point I want to make. The second point I want to make, which I think is really significant, is the history of gerontology and thinking about aging in the West has been premised on two things: the welfare state and the age of retirement and pensions. And when we think of Asia and Africa, without the notion of a universalist welfare state, when we don't think of a state which is going to do everything, especially in post-socialist China, or we think of South Asia, in India, for instance, what are the kinds of solutions we look for, looking beyond the state, looking at partnerships that exist beyond, and how does the public really understand aging itself beyond the welfare state? And the concerns then are different, because aging itself is not tied to the chronological definition of 60 or 65, because the way it's come up in the West has been deeply associated with the age of retirement and pensions. So how do you, when, in a society when there is only 5 to 10% of the population which is part of the formal workforce, they work basically until their activities of daily living continue. So like Abhijit Banerjee's research, for instance, talks about living and dying on $1 a day in India. What we are speaking about is basically there is no retirement for the poorest of poor. They work till the day they die. So there is no question of being able to say aging starts at 60 or 65. So I feel that the only way we can look at this is through a life course perspective, which we can offer policymakers to say we are not talking about aging starting at 60. When there are women in Ghana who've had 5 or 6 children, have had a long history of chronic disease and poverty, they will say, I feel old and aged and physiologically old at 45. You can't start a pension plan for them only at 60. So I want to question one or two things. What is the notion and importance of chronological age itself in societies where actually people have been through insults and injuries, biological insults and injuries, environmental toxicity and pressures which could age them before? Or if you're middle class and well off, you will age at 60 and 65 and get a formal pension. So I want to raise a couple of questions about how we have categorized aging based on Western gerontology, which has basically been framed by welfare states and pensions. And in a post-welfare state scenario in places like Asia and Africa with a large informal workforce, which is probably 80 to 90% of the population, I feel that we really need to look at policy very, very differently. And we're also speaking of an environment really, and this is what I want to bring out. We're speaking of an environment where we're speaking about social pathways of aging that are really complex. We're speaking of social and cultural changes, policy environments that don't really exist. When I began to do my interviews for my book, both in South Asia, in Zimbabwe and South Africa, you couldn't really find one ministry devoted specifically to aging which you could go to. You could have an aging department located in the Ministry of Sports, you could have it located in rural development, or you could have it located in something as stigmatizing as poverty or beggary or other things. So there's this notion of aging being associated in policy terms with destitution, dependence, and this is really a huge policy legacy. So most of my interest is really how do you make a population that's invisible in policy terms visible to policymakers? And that is a huge challenge because I feel there is a missing vocabulary partly in South Asia and also in Africa in being able to introduce aging to policymakers. And I'll come back to the second slide later. And one of the key questions really is that aging is associated deeply, longevity is associated with poverty. So most of the programs, for instance, in India, when we speak of aging, policymakers will actually tell you that they have an old age pension scheme. It's a pension scheme of about 200 rupees if you're 60 years old. It's 500 rupees if you're 80 and plus. That's about $5 per month or $8 per month for those who are below the poverty line. So you have one group that's below the poverty line that is covered by policy, but this is basically aging and longevity being equated to poverty. So you have poverty plans and mean-tested policies for aging, and that's what most policymakers will take you towards. But these are people who are called BPL, or below poverty line, and means-tested policies exist for them. But there's also the second challenge, which is that aging is happening in societies in Asia and Africa that are also societies that are very, very youthful. So it's very difficult to go back to policymakers and say, when you've had a history of overpopulation, the vocabulary that they know is family planning, high fertility, and to go to them and say that aging is actually a crisis and a challenge, it really means that they have to go away from the promise of development and globalization. For them, all that really has been significant so far is a promising working age ratio, the promise of a demographic dividend. They don't see the promise of a gerontological dividend that comes up immediately. And I think that's a real challenge. They feel they need to train young human capital, which is really a priority. So I feel that when we think of policies, you cannot, in societies without a welfare state, think about making aging simply a distinct policy category. You have to tie it with another concern, which is youth. there is a need really to look at intergenerationality and intergenerational and cross-cutting policies, which I think is critical to be able to go to governments, particularly in South Asia and Africa, to be able to say that you want aging-related policy interventions. And these can happen. I went to a policymaker, for instance, in the southern state of Tamil Nadu. They have a nutrition program for girls that starts from the age of 12 or 13 and goes through their life. But if you actually say that aging is related to the nutrition of young children, that if you feed them well when they're in their youth, they're going to be women in their older ages who are going to be healthier, and it's going to cost you less to be able to take care of them, they will see it as a life course intervention. But when you relate aging to public health policies that are related to motherhood, to fertility and youth, that's when you feel that you really get that vital policy intervention point to be able to say that this is, you don't relegate aging to this underfunded, marginalized department of aging where no bright bureaucrat ever wants to be posted. All the leading civil servants don't want to be posted to be able to do aging. And so it's really something you have to make as an incentive to be able to see that it has to be allied in some ways to be able to be allied to the vocabulary of productivity, which I think all of these nations really feel that they want to go towards. So there's also a long history, of course, both in India and China, of population control and population challenges. So it's very difficult in policy terms, really, when you have a youth dependency ratio, which is almost 82% in places like Nigeria. You have an elderly dependency ratio for the moment, if I might use the word dependency without any pejorative association with it, of 5%. So what we're looking at is something that comes up in the future. And policymakers, as we all know, operate within an election cycle, or they look at the short term rather than the future. So I think it's very important, therefore, to be able to do bridging policies that don't separate, like the AARP does, older people in a separate category. In all of these countries, you have to speak of generationality and intergenerational support, and policies that are invested for people who will age in the future, but investments and interventions that you make either in the 20s or that you make in middle age. So I think that's the only way you can speak without talking about the oldest of old, who are already viewed as people who are in poverty, dependent, and they need sustenance. So this is again, in India, the ratio between adolescents and the elderly, and you can see it's kind of coexisting. At the moment, you see a large adolescent youthful population, and the future is something that they have to focus on. The third point I want to make is about longevity and social pensions. When we speak about senior citizens, whether it's in Nigeria or India or other parts, people are not talking about people in the informal workforce. The main point of senior citizenship, or the notion of social pensions, is clearly associated with provident funds, pensions, health coverage that have been there since the colonial period, but basically they mean retired bureaucrats and a public sector staff. That's potentially 10%, 8 to 10% of the workforce, mostly a male middle-class workforce. And in India, it's a Hindu male middle-class workforce who are called senior citizens. They lobby policymakers just before elections. They're able to get pension increases. But we then leave out what's the large policy gap. To me, that's the most poignant part of aging in Asia and Africa, which is the unorganized sector. The gap really lies in the informal workers, domestic workers, agriculturalists, and the oldest of old, who don't get covered either by the below poverty line policies or by the social pensions and other things that are covered for the formal workforce. So you see this large gap really between the poorest of poor and those who actually who are in the organized sector and who get pensions. So pensions and retirement do not, as I said earlier, define the threshold of aging. There is no retirement or successful aging and volunteering for the poorest when you're struck by chronic diseases by the time you're in your 40s and 50s. So I think these are really important kind of policy framings.
With respect to the fact that only 10% people are get the pensions,
Yes.
if you will, are those pensions contributory, such
Yes.
as the Social Security, that they pay some tax based on their income
Yes.
into a trust fund?
They do.
Whereas all these other workers who are outside that would not be
Would not.
in a situation where, say, we're paying a tax in, right?
No, they don't.
So that's the the de facto justification
Yeah.
is that, look, they're paying into this fund, whereas these other
Right,
people aren't.
right. So they're paying into a fund, or there's a scheme of pensions. The others don't, but
Sure.
all
No,
if they are
I get
poorest of poor, you get a means-tested pension. They don't, but on the other hand, they're also expected to have saved enough, but on very low salaries clearly through the year, not to have saved enough.
So some section of those 90% do get these 200 to 500
Rupees.
rupees a month.
Right.
Which gets your pizza, basically, right? Yeah.
Well, pays for
Maybe
no
a bit
medicines. But maybe it gets no medicine or any kind of other care, which is basically catastrophic out-of-pocket expenses that you have at that point of time. So you can see it even in the case of Rwanda, for instance, since I was looking at Africa with one of my students. You see you have a government-sponsored 1 cow per family Agrinka program. You do have a pension scheme, which, but again, it's only for the formal sector of workers with coverage estimated to be 5 to 6%, which is even lower. You have medical schemes that include all civil servants along with pensioners and some private institutions. But again, you see an entire majority of people, really, who don't have that kind of coverage at all. So what are we looking at? Are we looking at states then that both in India and China evoke notions of filial piety and say that they have to really go back and rest on the family for support? Are we then looking at long-term care for older people that relies on the family and on intergenerational support? Are we looking for communities to manifest what Erik Erikson calls generativity, or the notion really that older people and younger people have to tie themselves together in certain kind of